And it is my pleasure this morning to introduce our speaker for today, Dr. Maria Carmenza Mejia. She is an associate professor of family and community medicine at Baylor College of Medicine. She has a great research interest, which is including health disparities and inequities primarily centered on the underserved and minority groups, as this intersects with cancer care, chronic diseases, tobacco cessation, substance use disorder, and social vulnerability. Dr. Maria Mejia leads clinical and public health program implementation, including implementation science to delivery, evaluation and outcomes for population health, and increasing access and quality of care. So I will stop sharing my screen at this time, and I will turn it over to you, Dr. Maria Carmenza Mejia. Over to you. Thank you very much.
Thank you, Dr. Rajaolit. Good morning, everybody. It's a pleasure to be here this morning to share a little bit about lung diseases and how a couple of tips that we can do to improve our lung health. Just as an introduction, chronic lower respiratory diseases, including asthma, COPD, and lung cancer, are a major cause of mortality in our country. So they lead about they are number 6 of the leading causes of death. So it's an important topic. Respiratory diseases do affect millions of people in the country, as I mentioned, and it's what we want to do today is to highlight the benefits of regular checkups, screening tests, and lifestyle modifications to reduce the risk of developing respiratory illnesses. So our objectives for today include to identify common respiratory diseases such as asthma, COPD, and lung cancer, recognize the importance of early detection and prevention strategies for respiratory diseases, and of course to encourage proactive measures for respiratory health, such as maintaining a healthy lifestyle, exercising regularly, and vaccination against common diseases like flu or influenza and pneumonia. Let's start with asthma. Well, asthma is a major non-communicable disease and affects both children and adults. It's more common in children, but it does have effect about 1 in 13 adults. What it causes is an inflammation of your airway, so the narrowing the passes for air that goes from the nose to the mouth and to the lungs. So it causes symptoms like tightness of the chest, shortness of breath, wheezing, and a lot of discomforts. More important to know is that asthma symptoms can be triggered by different things for different people. Allergens, which are the particles that can cause inflammation or trigger an asthma attacks, include like dust or pet dander. Those are very common. Some people are allergic to pollen. Some people are allergic to the cold in the morning, or even exercise, or even to some foods, right? Asthma doesn't go away. It can really be cured. And the symptoms again can be triggered for different things. It's a serious disease. You can actually die from an asthma attack. And there is no cure. However, with appropriate treatment, we can prevent asthma attacks, and we can also help you have a better quality of life. In other words, good maintenance treatment can prevent asthma attacks and keep asthma under control. So common signs and symptoms include, what I mentioned, the breathing or shortness of breath, the wheezing, the coughing, the tightness. Things to know, to be aware of, is that the asthma symptoms often follow a pattern. They can come and go over time or within the same day. They can get worse with viral infections, including the flu, the common cold, or pneumonia. For some people, the symptoms can be worse at night, or they can be worse in the morning. There are different diagnostic tests. Just to be familiar with, for those who have symptoms of asthma, or live with asthma, or have family members or friends that live with asthma. So how do we make the diagnosis? Well, you have the symptoms, you go to the doctor, and the doctor can order what we call a spirometry. This is a lung function test that measures how much air you breathe out and how fast you can blow air out. Right? It can be done alone, or it can be done with a medication, or with a bronchodilator. We also have what we call bronchoprovocation test. This is pretty much you go to the doctor and they expose you to an allergen to trigger the inflammation in your lungs, right? So it lets you, what it tells us is how much inflammation or how severe can be the response when you are exposed to certain allergens. Then we have the peak respiratory flow. This is very common, not only for people who are experiencing symptoms of asthma, but also those with COPD, emphysema, and so forth. The exam pretty much measures how fast you can blow air out using your maximum effort. Then we have other tests less common, like the nitric oxide, but we also have the allergy skin or the blood tests, which are more frequently used in children, but we can also use them in adults. Okay, different triggers for asthma. So it can be acute or a chronic, and might have synergistic effects. For example, you are under the weather, or you're experiencing a cold, and then you exercise. So the number one trigger, the number one allergen is smoking. That's the most important recommendation and most important lifestyle change that we recommend to people who have symptoms of asthma or any other lung illnesses, right? Pollution, of course, we have different allergens, as I mentioned before, viruses, including common colds, flu, and also some bacteria that cause pneumonia. We have perfume emissions. Some people are allergic to these strong smells, and it has to do with big particles. Also, some people can be triggered by exercise and cold air, and of course, occupational exposures are an important trigger for some people. Levels of asthma severity. This is for informational purposes, just to be familiar in especially if you are experiencing symptoms. This is something that you can discuss with your doctor to learn more about the disease. It can go from intermittent, so you have symptoms on and off. Usually they last less than once per week. And after that, they can progress in severity from mild persistent all the way to severe persistent. Is when you have symptoms pretty much all the time, and they can be more severe at night, and they are very limiting in terms of any physical activity and quality of life. Management. I mentioned that there is no cure for asthma, but appropriate treatment prevents asthma attacks, and it can help you to have a better quality of life. We have the so-called rescue inhalers. These are bronchodilators, and what they do is that they help to open up the airways when they are too narrow and causing the shortness of breath, right? You have the short-acting, the long-acting. Then we have the corticosteroids, what we call the anti-inflammatory medications. Remember that asthma is an inflammatory disease. They have different kinds. We also have a combination of both medications, the rescue inhaler and the corticosteroid. And then on the other spectrum, we have the modifiers, the Leukotriene modifiers and the biologics. The Leukotriene modifiers, these are just medications that what they're trying to do is to manage the inflammation. Leukotriene are inflammatory molecules that are produced by some cells in that body in response to allergens or any other trigger. So what they do is they trigger an inflammatory response. Sometimes, particularly in asthma, the response can be so severe that it actually causes more symptoms, including shortness of breath, because it narrows the airways. So what they pretty much is that they help our bodies to kind of manage and regulate that response better. Biologics are the newer medications. They just came out in probably in the last 5 years, became very popular. They're also very good, particularly for those who have severe symptoms for poor response to traditional medications. Okay. So the key for asthma management asthma in children, but especially in adults, is the long-term management and monitoring. It's very, very important to become familiar with the signs and symptoms and alarms, and don't just prevent or treat early. Don't wait until you have severe symptoms or shortness of breath, right? As at the time that you start experiencing symptoms, it's recommended that you immediately start the medications that were prescribed, or you see your medical provider for recommendations. One of the main goals management of asthma is to have an action plan. This is something that you discuss with your primary care doctor or with your provider, and usually either your nurse or someone else who is helping patients with asthma to manage their disease. Includes the management in familiarity with the peak flow meter, which you can do it at home, and you can learn to see, even though you might not be symptomatic, your lungs might tell you otherwise. It can be just, we use the colors just as to kind of be more familiar and be able to kind of develop different plans, depends on the severity. We had the green zone, the yellow zone, and the red zone for those who have severe symptoms or asthma flare-ups. This is what I call the asthma plan, the asthma action plan. There are different forms. Every doctor has a different template, but mainly what it is about is that it's like a prescription for managing your symptoms, and to be alert and aware of alarm signs, and when you should start managing or using your medications at home, and when it's time to go and see the doctor or visit the emergency department. Okay, let's now talk about chronic obstructive pulmonary disease. This is the 4th leading cause of death in the US. It is pretty much a group of diseases that cause airflow blockage. It narrows your airways or can literally cause physical blockage, and of course that causes breathing related problems. It includes 2 main conditions. The first one is emphysema, and the second one is a chronic bronchitis. In the emphysema, the damage of the walls or between many of the what we call the air sacs, that's where the air is clean and gets oxygen that it needs, it is destroyed. So let's say that the ventilation system in your lungs is broken. The issue with emphysema, and we almost always tell our patients, and that's there is no way to, when the damage is done, it's done. There is no medication, there is no treatment to put together those air sacs back, right? The chronic bronchitis is caused by a repetitive or constant irritation and inflammation in the lining of the airways. This one is the person who has a lot of productive cough, or what we call wet cough. Those patients with emphysema, they have more that like a dry cough. That's the main difference that we notice. But sometimes they overlap because patient has been exposed to different injuries from the smoking, from exposure, or from even history of chronic asthma. Okay. So who is at risk for COPD? Well, smoking is the main risk factor. It's the #1 cause of COPD, right? About 75% of the people who have COPD also have a long history of smoking, or even current or former smokers, right? Long-term exposure to other lung irritants, such as secondhand smoke, air pollution, and chemical fumes and dust from the environment in the workplace, are also an important cause of a major cause of COPD. Age. Well, most people who have COPD are at least 40 years and older when their symptoms start, right? So it takes a long time, a couple years of exposure to either smoking or other environmental factors to develop COPD. This is something that you are not born with. This is something that is acquired over time. Or develop over time. We also have genetics. This is an alpha-1 antitrypsin deficiency. So this is probably the #1 main genetic cause, which is what it does is that if you have the genetic condition and you smoke, or you are exposed to secondhand smoking, you are more likely to develop COPD. Or if you have a family history of COPD. People who have asthma also have a more risk of developing COPD than people who don't have asthma. But most people with asthma will not get COPD. So asthma is not, it doesn't immediately give you a diagnosis for COPD, right? But once you get asthma, then you might most likely to get COPD. Okay, so what are the symptoms? This lingering chronic cough that doesn't go away. Sometimes it can be productive with a lot of mucus, is what we call the smoker cough. Shortness of breath, you can notice that you have more difficulty breathing, or you might find yourself gasping for air more often, even with a short or mild physical activity, just by walking one flight of stairs, or you notice that you used to be able to walk a mile, and now even after a few feet, you feel like you're short of breath. Okay, we're also very common, the wheezing or the whistling. They can be this squeaky sound when you breathe, either in or out. Chest tightness or heaviness, you feel more tired, you feel more fatigue, and of course difficult sleeping, because of course you cannot feel comfortable laying down, and you can be short of breath in that position. So what type of treatments do we have for COPD? #1, quit smoking. That's the most important thing that you can do to help to slow the progression of COPD. We also have medications, and the medications are used depending on severity of the symptoms. They're very similar to the ones that we use for asthma. We have the short-acting bronchodilators, or rescue inhalers that we call. We also have the long-acting ones, and then we have the combination of the bronchodilators and the inhaled steroids or corticosteroids. Pulmonary rehabilitation, just think like a gym for your lungs. It includes a lot of exercise that are similar to the equipment that is used for diagnostic testing. And the idea is to help your lungs to expand and to start using other muscles that we don't use on regular basis. Then we have, of course, Oxygen therapy. That's when we use oxygen as a medical treatment. Some people might require surgery. Usually the last resource for people who have severe symptoms and have no improved or no responded to traditional medical treatment. That includes, I mean, this is just beyond the scope, but just to be familiar with the terms, your doctor might tell you, or the pulmonary specialist might tell you that you need surgery. One of those is bulectomy. So it removes is one or more large bullets from the lung. So those are in emphysema. I mentioned that the lining or the walls of the lung are destroyed. So they convolute like in a whole huge balloon that is not functional, right? So the surgery, what it does is that kind of pop those balloons to be able that for the good parts of the lung to expand and to improve your respiratory and your oxygenation. Sometimes we have what we call lung volume reduction surgery. That is pretty much what the name says, is removing damaged tissue from the lungs. So part of the lungs that are not functional, and the idea is that when you remove that part that is not functional, the parts that are still working well will expand and will take over the part that was removed, right? And the last resource is the lung transplant, which is removing a lung that is ill or a so-called diseased lung and replacing it for a healthy one. This is the very much last form of therapy when patients do not respond to any other forms of therapy. Okay, so what are the major differences between asthma and COPD? Well, the age, usually when the diagnosis is made, asthma is more commonly diagnosed in the childhood of adolescent. However, adults can still be diagnosed with asthma. COPD is more commonly diagnosed later in life, usually after 40. The history of smoking, nearly all patients with COPD have either smoked or have significant exposure to tobacco smoke. This is what we call secondhand smoking. Let's say, do we see this a lot in women whose their partners, they might not be smokers, but their partners do smoke for many, many years, so they've been always exposed to it. And patients with asthma are mostly non-smokers. Triggers, asthma is worsened by the exposure to allergens or some irritants. In COPD flare-ups, they're mostly caused by exposure to viral illnesses or respiratory tract infections. They usually, that's the main trigger. Treatment goals for asthma is to treat the chronic inflammation, and for COPD is to reduce or to manage the symptoms. There is a connection between asthma and COPD, and your doctor, for those who have either disease or both diseases, your doctor might have talked to you about it. So both are chronic conditions, and they can be diagnosed with a pulmonary test that I mentioned earlier, the spirometry. This is the one that you blow to see how much you can blow. So since both conditions share the same features, they can be hard to tell which one is what. So the overlap or which one started first, particularly when you start developing symptoms of asthma as an adult. However, management is, for the most part, can be similar. Is a bronchodilators and corticosteroids. But about 40% of patients who have COPD also have asthma. It's because this inflammatory component start overlapping very much when you have COPD. So as patients get older, the likelihood of overlap syndrome increases between the both conditions, right? So what happens is that symptoms or COPD symptoms can be triggered now by a single exposure to high doses of certain irritants. Your immune response is not what it used to be, so your lungs start overreacting to certain things in the environment. So that's where the overlap comes. Okay, let's see. So what is the overlap symptom? Well, it's just you have both asthma and COPD. Symptoms include very much the same, difficult breathing, shortness of breath. There's more production of mucus rather than dry cough. You're feeling tired, the coughing, the shortness of breath, and the wheezing. What happens is that when you go to the doctor can tell you that because you have a combination of symptoms or overlapping asthma and COPD, the treatment plan can have some changes or might need some alterations. So you might respond better to some inhaled bronchodilators. You might need medications or strong lung rehab to help you to breathe better. And also then the use of certain disease modifiers or like the Nicotrines and biologicals that I mentioned with asthma, this might be of benefit to you. Okay, so the treatment very similar. You use it's pretty much inhalers, corticosteroids, bronchodilators, and here there is a place for long-acting muscarinic agonists. These are again medications that are used to manage some of the symptoms. So what it does is that helps the cells in your lungs to reduce production of too much mucus. Now we're going to pass to lung cancer. All right. So lung cancer is the #1 killer in the U.S. Okay. There's two main different types of lung cancer. We have the small cell lung cancer, is less common. And we have the non-small cell lung cancer. That is the most common form. And it can have three presentations, what we call the squamous, the adenocarcinoma, or the large cell carcinoma. What is important, because this is the #1 type of cancer for those who have a history of tobacco use. Who is affected the most? Usually is people older, like older than 50. The reason is that it's caused by a continued and long-term exposure to carcinogens such as tobacco use and smoking, right? And of course, smokers or those who have a smoking history have a higher likelihood or higher risk of developing lung cancer. So the symptoms, they're very similar to when you are symptomatic for lung cancer. It's very similar to other respiratory illnesses. You start having this persistent cough, shortness of breath, coughing of blood, wheezing, chest pain, and of course the symptoms related to cancer itself, which is the unexplained weight loss or unexplained tiredness. They seem all very general, and because lung cancer symptoms in the severity shows up when the cancer has already advanced, is that we recommend lung cancer screening or early detection. By the time that you start having symptoms of lung cancers, the cancer has already spread. So the main causes, #1, tobacco or smoking history, race, that includes cigarettes, the pipes, the snuff, and chewing tobacco, and now vaping. Okay, radon exposure is not a big thing in Houston. It's more in other parts of the country, but for those who come from areas where radon exposure was high, just keep that in mind too. Occupational exposures, this is a big issue in our area because of the refineries and other environmental and occupational exposures. We also have arsenic, asbestos for those who work on construction, and as well exposure to silica. So the diagnosis, how is it done? Well, we have the chest X-ray, and we have the CT scans. These are, and then we can progress there from PET scan, bronchoscopy, and biopsy. Now let's talk about lung cancer screening. People who currently smoke or have quit in the last 15 years have a higher risk of a lung cancer, especially those who are 50 to 80, have smoked at least 20 pack years. That means that you have smoked at least 1 pack a day for 20 years, or you are currently smoking or have quit in the last 15 years. This is what we call the higher risk, and that is why our eligibility criteria for lung cancer screening is defined by. Okay. So the number one prescription that we have to prevent respiratory illnesses or lung illnesses, including lung cancer, is smoking cessation. If you start having experiencing shortness of breath or a lingering cough that doesn't go away, the first thing that your doctor is going to ask is whether you are smoking. So it's very, very important that we feel comfortable sharing our tobacco use with a doctor. That way we can help to in your cessation path. Right. What we try to do to help our patients on quitting smoking is to develop a more personalized plan. What it means is that we all have different needs. Tobacco use is a chronic relapsing disease. It might take a few attempts to quit in order to be successful. Some people might be just quitting cold turkey. Some people might need help with medications like the patches or the gum, the Orson, other medications that are available like the bupropion or the varenicline, which is the previously known as Chantix, right? What are the benefits of quitting smoking? Well, certainly, it can decrease your risk of developing lung cancer and 11 more cancers, from esophagus to throat to liver to stomach to colon to breast, prostate. The list is very long. So the benefit of quitting smoking is quite clear. Right. It can also help to prevent other illnesses, chronic illnesses like heart disease, stroke, emphysema, loss of your vision, and diabetes, high blood pressure. Super important for those who have family members or with other chronic diseases in children. Secondhand smoking. This is something that we don't talk very much about it, but it's very important. If you have grandchildren who come home, even though if you don't smoke when they are present, the tobacco particles are still on your clothing, they are in your hair, they are on the sofa and the fabrics and the carpet. And the kids, well, because they are smaller, exposure to small amounts of tobacco means higher exposure, right? So any exposure to tobacco for children or people with other illnesses that put in a higher risk, like when they are immunocompromised, can really be fatal or very detrimental. So when it comes to the process of smoking cessation, well, we are all different stages. Some people are ready to quit. Some people might just in that contemplation process. Some people might just not be ready. But having the conversation about it is the first step to make a change or to succeed in your cessation path. Right. So like I mentioned, we have nicotine replacement therapy. This is it still has a nicotine. So the idea is that you stop smoking this tobacco use, the cigarettes, and you start your patches and replace the nicotine that you get from the cigarettes through the patches. It's not meant to be smoking in patches or be using the NRTs or nicotine or the patches forever, right? The idea is to to quit completely, and you just can wean off or taper off slowly, just again based on your own needs. All right, let's see. We have other products that contain nicotine. The nicotine spray and the inhaler that are less commonly used might be probably they will be out of the market very soon, but some people might have used them. They're more expensive, and they do need a prescription from your doctor. The patches and the gum, they don't need a prescription from your doctor. They most of insurances do cover. You also have help from the quit line. The price average from the Walmart pharmacy or any other local pharmacies from about $20 to $30 for a 2 weeks treatment. Okay, prescription for smoking cessation products that do not contain nicotine. So there are currently 2 medications that have received FDA approval. We have the varenicline, formerly known as Chantix. Now we call it as a, we know it as a Apple varenicline. Apple is the pharmaceutical that's producing it now, and of course the bupropion or Wellbutrin. What these 2 medications do is that they help manage the cravings, right? They add in your brain and pretty much tell your brain, hey, you don't need to use nicotine to be alert or to feel comfortable. That's pretty much what they do, and they can be taken for long-term or as needed. We have consolidated behavioral therapy. For some people, this can be a great approach or in support. Some people just need a constant reminder that why it's important to quit smoking. Yes, it's hard. Let's walk through this one. Others have quit. We can also quit. And it just connecting with the right counselor or the right behavioral therapist can be very helpful. Sometimes the smoking is just used as an outlet for anxiety. So the counselor can connect with a behavioral therapist as well to kind of co-manage any other behavioral or mental health issues that you might be experiencing. There are different techniques, different approaches. The 5 R's is one of those. It's just talking about the relevance. Why is this important for me to quit smoking? For some people can be to be able to spend time with family, including grandchildren, for example. For others, is because they just have a heart attack and the doctor told me that if I continue smoking, the likelihood of having another fatal heart attack is quite high. Or perhaps they found a lung nodule that looks good now, but if I continue smoking, that might be evolved and become a malignant lung nodule and become lung cancer, for example. Or just having difficulty breathing. I'm not able to enjoy it, going for a walk in the park anymore because after a few steps, I just feel this tightness or I need to gasp for air. So just finding the right motivation to quit smoking. Then the risk. Usually is combined. The relevance and the risk can go together. Is relevant because you don't quit. Well, might be more a higher risk of experiencing some of the negative effects of smoking. The rewards, what do I get from this? Well, I might get not only the physical and the health related rewards, but maybe saving a couple some money, right? Cigarettes are getting more and more expensive, and there can be some savings right there. And also, if I quit smoking, I might have less symptoms of COPD, asthma, and so forth. So less money that happy to be spent on going to the doctor or ER visits and so forth. The roadblocks, of course, the habit. Sometimes we use smoking as a way to socialize. Like we hear quite often that people that are at work during the break, what you do is that you socialize with your coworkers and we are smoking. Not even that I want to smoke, it's just that's what we do. That's the thing that is done, right? So maybe there's some behavioral things that can be, if we are aware and we make a conscious effort to modify those behaviors, well, that can be very, very helpful. Repetition. This is a constant reminding. Again, it's a relapsing disease, so it was going to need constant ongoing support to be able to succeed, right? There are quit smoking hotlines, several. They might provide resources to free resources like patches and also some counseling. They're different. They have different languages. There is also a text messaging option for those who are more tech-oriented. The younger generations might be more comfortable with text messagings. Then there are apps as well. They offer quite really nice tips and also keep you on track. It's a reminder of, oh, perhaps instead of a cigarette, maybe perhaps you can go for a walk or use a lollipop, something, things like that. Okay, finally. So we want to end today just encouraging again with proactive measures for respiratory health. This is super crucial, very crucial in preventing respiratory diseases and maintaining the overall well-being. Some tips to promote respiratory health, including preventing the spread of respiratory infections. That means vaccines that are relevant or recommended for age, chronic conditions, or the seasonal ones like the flu vaccine, COVID vaccine, the pneumococcal vaccine, right? Promote a smoke-free environment. This is something that we all have to be in sync or proactive and work as a community. Not only smoke-free environment at home, but also in other spaces, public spaces. Address the indoor and outdoor air quality. So this is an issue that has gained a lot of traction recently, either because of the fires in the north and also the heat waves that we have, and of course because we are in an area where there is a lot of environmental exposure because the history of refineries and so forth. So now there are monitors that are helping us to be aware or raise awareness about the quality of air. Many people have cell phones, and they have apps, or the cell phones have apps, free apps that can tell you the quality of the air. Also, you can tune on the news. They're everywhere. So if you enjoy outdoors activities, just think about it, check the weather, check the air quality, and the recommended times to kind of go out. Regular physical activity, very important, can be outdoors, can be indoors. Now with the heat waves that we have, probably indoors is better, but just stay active, just pace yourself and go and increase the physical activity as you go. Sometimes because we have chronic illnesses or other challenges to do a physical activity, we can look for something that is low impact, like swimming, water aerobics, or just equipment that we can use at home. Stay up to date with the recommended immunizations. I mentioned it before, very, very important, particularly after a certain age. And if we have chronic illnesses that require continuous management, that increases the risk of us catching some infections. So staying up to date with immunizations is super important. Regular checkups with healthcare professionals and having access or to recommended screening practices. We all familiar with mammography. We are familiar with prostate cancer screening, colon cancer screening, but we are less familiar with lung cancer screening. So this is a conversation that you can have with your primary care doctor, just if you are a smoker, a current smoker, or you smoke in the past, talk to your doctor to see if you are eligible for a lung cancer screening. And lastly, the healthy lifestyle, including the consumption of balanced diet, avoid smoking, and excessive alcohol consumption. These are all tips that we recommend to stay healthy and to maintain a good quality of life. That's it for today. And then any questions? So we want to go to the panel.
Yes, thank you so much, Dr. Mejia, for that, amazing presentation. We have one or two questions in the Q&A box. And for those that are on site, thank you for your engagement. Please, our team members will be passing across, note cards. Please write down your questions so that we can take them right at the end of this panel discussion. So thank you very much, Dr. Mejia, for that awesome presentation. I think this will be a good time to bring up stage and welcome our two panelists that will be joining Dr. Maria Mejia today. First, we have Ms. Adriana Rangel, who is a respiratory therapist at Baylor College of Medicine. Thank you for joining us this morning. We also have Ms. Johanna Rodriguez, who is a health educator in tobacco cessation specialist. So thank you both for joining. You can come off the camera and unmute yourself so that we can have a quick discussion regarding the great things that has been discussed this morning. I will turn it back over to you. Thank you.
Thank you. All right. Do you want me to address the first one? So,
yes.
Marcela asked about respiratory problems in the dirty air conditioning ducts. Yes, and people that work on laundry places exposed to the fabric flow. Yes, that is correct. These are all what we call environmental exposures, right? Now, we have a more open conversation about air quality, and air quality includes the outdoor air quality and the indoor air quality. Right? During this heat wave, the indoor air quality is a crucial issue. Some community members might be aware of the need to change the filters, right? For example, every so often, either because of different challenges, either access, knowledge, or just financial constrictions, right? Sometimes a air filter can be expensive. The laundry places, these are public places that many people don't think about it, but we hope for management to pay attention to the indoor air quality. So perhaps we can advocate as a customer, you could advocate with the management to be more proactive on keeping up to date those filters. You still have to go to do laundry, right? So what you can change is perhaps advocating, being outspoken about the importance of staying up to date with those filters in those public locations.
That's awesome. Thank you so much, Dr. Maria, for shedding light on that question. And one of the questions that came in earlier during your presentation was about genetics. So you talked, extensively about smoking and other risk factors. But the question specifically was asking if there are any genetic relation, between asthma, COPD, and or lung cancer. What are your thoughts about that?
Well, the field of genetics is evolving very much. What we know specifically right now is only one specific link, which is the alpha-1 antitrypsin deficiency. That's a genetic. And what it does is that it increases the risk of developing asthma and COPD, not as much of lung cancer. However, what we know now is that is what we call epigenetics. So it has expanded not to just one gene, but multiple genes that when they are exposed to certain triggers or what we call environmental exposures, they all together create the perfect storm. and that increase the risk of lung cancer. But there is no current available test, genetic test, that can tell you that you are a higher risk of lung cancer. Usually, the markers that we are developing right now are more for tell us what kind of cancer will be more responsive to certain treatments. So it's still the number one cause, genetic, non-genetic cause of any respiratory illnesses is tobacco use. That's the message that I want to get across. And there's more efficient preventive care approach, initiative, intervention that we can have in our community and also at the individual level.
Awesome. Thank you very much for shedding light on that, because we always hear, especially with cancer, right? You know, is there any genetic influence? And everyone is curious to know more about that. So absolutely, thank you. One question that came to my mind, you know, during your presentation, you talked about, you know, direct smoking. Is there any linkage between secondary smoking, right? You know, people living in the household with someone that smokes, is there any linkage, you know, with secondary smoking to any of these diseases, COPD, asthma, or lung cancer? That's one. And then could you possibly expatiate a little bit on how do we define one packed year, right? You know, when you were talking about the risk for lung cancer, you know, you mentioned 20 pack year. So what exactly is one pack year? And that can be for you, Dr. Maria, Mejia, or Rangel, or Rodriguez, Joanna, rather. Thank you.
Do you guys want to take on that, any of that?
I can explain on that pack year. So on the pack year, how you define a pack year is, so 20 cigarettes equal one pack year. So the 10 cigarettes, that will equal a half a pack year. So if people are smoking 40 cigarettes, then that's considered 2 packs per day, or 2 packs per day. And then the pack year itself is multiplied by the years the person has smoked. And so like the years that they've smoked and the years when they started smoking. So you, and then you multiply it by the packs per day.
Okay, so thank you. So just, you know, for the knowledge of the audience, right? So that when we are trying to figure out, you know, where do people stand regarding the risk. Thank you very much. And then any comments on the secondary smoking risk?
So I wanted to comment on asthma in particular. So there is, so like for babies, if babies go in, you know, like the RSV season was going around, and usually those babies tend to wheeze. And if it's a 6-month-old, you can't do spirometry on a 6-month-old, right? They're not gonna, because it's a, what do you call it, effort dependent exercise, right? So sometimes, you know, the doctors will say, well, hey mom, hey dad, do you have a history of asthma? The mom might say, oh, you know, I was diagnosed when I was 10. Yeah, I have asthma, but you know, it doesn't give me any problems right now. The likelihood for that 6-month-old to develop asthma is high because at least one of the parents has asthma.
Right.
Now, so I wanted to touch base with that, with the asthma. Now for COPD, again, the genetics are way different. You know, I've treated patients that their parents had COPD, but they never got COPD. You know, I think the main point is there are things that can increase your risk for getting COPD. One of the things is if the person is smoking. But when you go to secondhand smoke, I've treated patients who've never smoked in their life and they develop COPD because their partner or spouse has smoked for the 50 years that they've been married, right by them on the couch.
Right.
So
right.
they end up developing, and that's not genetic because it's their partner,
Exposure.
right? It's their merit. It's that exposure. So, you know, there can be people who will develop COPD and then they'll say, I've never smoked a day in my life. Well, you know, there, and again, there's a lot of research that needs to go on about the details about the secondhand smoking, although we know that that causes problems for people who don't smoke.
So in a nutshell, yes, secondhand smoking is as important or is as harmful as primary tobacco use, right? So it not only the person who smokes, but the person who is around the smoker can increase the risk of respiratory illnesses.
Awesome. Thank you very much for yes, yeah, regardless of the age, absolutely. Thank you for sharing, shedding light on that. We have one or two more questions, you know, from the online audience, but I want to see on site. Amir, do we have any questions? Maybe we can make a few minutes to answer those, and I'm also keeping an eye on the time. Amir, do we have any questions from on-site attendees? Okay, hold on, sorry, I think he sent me a chat. We do not have it. Okay, all right. So we don't have any in-person question at this time, so we'll continue moving along with answering the one or two questions that we have from online attendees. So one is asking, is singular a good option to treat asthma?
Yeah, I'll take this. Singular is what they call an add-on medication, but it's not used to treat asthma. So it's used to help with the whole allergic response that Dr. Mejia was describing in her presentation. Generally, the whole thing with asthma is that it's an inflammatory disease. So the way you control or you treat the asthma is to treat the inflammation. And the inflammation is treated by an inhaled steroid or inhaled corticosteroid. The symptom of wheezing and the chest tightness, we take care of that with a short-acting bronchodilator, which is what Dr. Mejia mentioned, a rescue inhaler that people might know about. Part of that asthma action plan, the asthma action plan, I was going to say this too, it should be a discussion between the patient and the doctor on what's going to be done when during an attack or when there's not an attack. Granted, the doctor is, you know, the one that's writing the prescription. They can add on different other medications. Like I've had patients that, you know, I get stuffy when I wake up. Okay, well, you're going to add on Flonase nasal spray. So it's an add-on. Singular is like that, an add-on.
Awesome. Thank you very much for sharing, you know, shedding some light on that. I'll take our last question for today. I'm looking at the time. I know the in-person attendees are excited to engage with the vendors, and I don't want to keep them, you know, beyond what is necessary. But the last question that we'll take today is basically asking about environmental factors, and if mask wearing, you know, when we wear masks, does that, you know, decrease the risk of environmental exposure and symptomatic development of asthma?
In general, yes, of course it can, because these are all allergens, right? And for everyone who has a higher risk of developing asthma, the more exposure, the higher the likelihood of developing. With that being said, the mask can be preventive. Because mostly not for the developing of asthma, because that's an inflammatory disease, but they preventing attacks and helping to prevent for management, right? If you have asthma and you go out during the pollen season, for example, this push and and that's one of your triggers, wearing a mask can help. Or if you go to out in days that are a lot of dust outside, wearing the mask can help to prevent an attack.
Awesome. Beautiful. Thank you. Again, I want to say thank you to you, Dr. Maria Carmenza Mejia, for joining us today. Thank you, Adriana and Joanna, for shedding light during this panel discussion. It has been a very, informative health education session. The recording of today's program is going to be available online on our YouTube channel. So anyone that is attending, or if you want to share the information, you are free to be able to do that. I'll go ahead and start sharing my slides so that we can wrap up with today's session. Let me do that here. All right, great. So again, thank you everyone for joining us. For those that are joining online, we have posted the links to our survey, the CHWCE credit and evaluation. All those links are posted, so please click on the link and you'll be able to complete those. For those that are attending in person, feel free to scan the QR code that you are seeing on your screen right now. And our team members are also there, passing across paper physical surveys, so that way you can give us your feedback on, what you learned from today's session and what you would like us to focus on in our future events. I would also want to take a minute to, announce our upcoming events next month. In actually 2 weeks from today, we will be having an immunization awareness session. This is going to be happening at Baker Ripley location, where we will be giving, free biometric screening, and immunization will be available to attendees at no cost. We would also be sharing a lot of resources and health presentation on immunization. So please save the date and feel free to join us on Saturday, August 5th. The session itself is going to be from 9 to 12, but the presentation will be from 9 to 10. In the same vein, we are also excited to share that, as most of us might know, that September is Prostate Cancer Awareness Month, and Texas Southern University is taking a lead in this aspect, where we'll be having our seminar face-to-face, shoulder-to-shoulder. Let's talk about prostate cancer. We would have health education, information, panel discussion with prostate cancer survivors. There's going to be, social media engagement, as well as on-site, no-cost PSA screening for family and friends. So please feel free to spread the word. This is going to happen on September 16th from 10 to 2 p.m. In the same vein, Breast Cancer Awareness Month is going to be in October. So Texas Southern University is going to have its second We Roar Against Breast Cancer event. This is going to be on Friday, October 20th at TSU campus. We would also be providing no-cost screening mammogram on site on that day, along with balloon release for breast cancer survivors and breast cancer education and panel discussion. So please save the dates. It's going to be Friday, October 20th from 11 to 3 p.m. From 11 to 3 p.m. on TSU campus. So please feel free to join us on any of these dates. The best way to connect with us is for us, for you to stay engaged with us on all our social media platforms. And when you scan the QR code that is at the bottom of this page, it will take you to our Linktree page, and that has a lot of information on all the things that we have ongoing. Again, I want to say a big thank you to our partners today, aka Precinct 2, for everyone that has attended, that has, connected with us this morning to make today's program a success. Thank you to the Baylor College of Medicine group, Adriana, Joanna, and Dr. Maria Mejia. I want to say thank you for making today's presentation a success, and definitely to all our attendees. Thank you for joining us both in person and online, and as well to our team members, those that are on site over there at Mejia, Snare, and Morgan, and to everyone that has made today's program a success. We appreciate you, and we look forward to continued success and engagement on our programs. Thank you again, everyone. We will disconnect online, but the on-site engagement will continue. Thank you again, and have a wonderful afternoon.